Hello everybody, welcome to my YouTube channel, Homoeopathy Super Sessions by Dr. Jarvis. Today I'll be doing identification of thermal state of a patient in practice. This topic was given to me by one of my subscribers who found it difficult to identify the thermal state. So let's see what this video has in store for us today. Well, firstly, if we define the thermal state, well, it is a condition wherein the person is affected by the environmental influences. So you have to remember that the thermal state is the personality's reaction towards the environment, or the person as a whole and its reaction to the environmental influences. It should be remembered that this is a reaction of the person as a whole to different climatic changes. Or in other words, also, it can be said, it can be defined as the reaction of a person to the different climatic changes, so the hot climate, cold climate, and so on. Please remember that cravings and aversions do not constitute the thermal state. This is a very common mistake which people are making. As a professor, teaching students also, and during the examinations also, you see, when they have a case to present, they always fumble up with the craving and aversions by saying that the patient craves for hot drinks, so the patient is a hot patient. So that is wrong. So you have to see the person's reaction as a whole to the environmental influences or the climatic changes. So just please remember that. Now, the different types of thermal states, as you all must be knowing, it's a chilly state, a hot state, and an ambithermal state. Or we say the patient is chilly, the patient is hot, or the patient is ambithermal. Well, chilly state is one wherein the person is affected by cold climate and is comfortable in the hot weather. So naturally, a chilly state will be when the person cannot tolerate cold in any form and he is comfortable in the summer or in the hot weather. Whereas the hot state is just the opposite of the chilly state. Here, the person is affected by heat or hot climate and feels better in the cold surroundings. So, in the hot patient or hot state, patient cannot tolerate the heat or the summer or the hot climate, and he feels better in cold surroundings or in winter or in the cold climate. Whereas ambithermal state is where the patient is neither comfortable in hot or cold climate. So, out in ambithermal, you are getting an in-between state where the stating that the patient is neither hot nor chilly. So he lies somewhere between the hot and the chilly state. Now, what are the parameters to judge the thermal state? Generally, in practice, we have these 5 parameters which are quite useful to judge the thermal state of the patient. That is the sun, the bath, open air, rains, and cold. So now, we have to ask certain questions about each of these points and then come to a conclusion by taking the summation of all these 5 points, whether the patient belongs to a hot or to a chilly state. So now let us see one by one something more about it. Where now the first parameter is the sun. So what question will you ask? You can definitely ask the patient, how does he tolerate the heat of the sun? Or does any condition get aggravated in the sun? So he'll say that when I go out, I have to wear a cap or I have to wear sunglasses. I cannot tolerate the sun because the moment I step up for half an hour, I come down with a throbbing headache. So this is a condition which may get aggravated from the sun. Then bath. Ask the patient the temperature of the water he takes the bath with. So does he take the bath with hot water? Does he take the bath with cold water? And so on. Or does he take more of hot water or more of cold water for a bath? Accordingly, you have to ask. Open air. Ask the patient his reaction to the open air or the fresh air. So you can ask the patient, how do you tolerate the open air? Or do you like to stay in a room where everything is closed? Or would you like the fresh open air to come in the room? So he may tell you, no, doctor, I would like everything closed because the moment I open the window, the strong breeze comes and I start sneezing. Now, about the rains. So ask the patient, if any of his or her condition or disease condition is aggravated in the rainy season. So, for example, asthma or rheumatism and other conditions, they may be aggravated in the rainy season, or even psoriasis and so on. So, also ask if he or she is affected anyway during the monsoon season. So you have to ask either of a disease condition being aggravated or what is the patient's reaction towards the monsoon. So they will tell you, no, that in monsoon I'm perfectly all right. The rains don't affect me. Or some people will say, doctor, in every monsoon I start sneezing. Otherwise, my sneezes, they totally disappear in the winter and in the summer season. But the moment the rainy season starts, I start sneezing. So out here you can come to important remedies like humidity aggravates or rain or the monsoon aggravates or the rains aggravate. That is natrum sulph, dalkamara can come out. So this may give you some hint. Now covering. Ask the patient if he or she takes a covering to cover oneself while sleeping, and also ask about the texture of the covering. So you have to ask the patient that when you sleep, do you take a covering, do you take a bed sheet, or do you take a small little blanket, or whatever it may be. And ask the texture. It could be a thin texture, or it could be a heavy texture like a blanket or a wool blanket, and so on and so forth. So some people say, no, doctor, even in the summer season, I love my thick blanket to cover myself up. I cannot do without it. So all these are the points to be asked or questions to be asked regarding these points. And then you can come to a conclusion whether the patient is hot or chilly. Say, for example, the patient is not aggravated in the sun. He always takes a bath with hot water, that is a geyser water. Even if it's very hot also, he would like hot water bath. He likes the open air, but he is not aggravated in any condition. The rains also do not aggravating him. And he always likes to take a covering when he sleeps. So, irrespective of the climate. So out here, you are getting that the patient is more on the chilly side, or is a chilly patient, or he has a chilly state. So after the summation of all these 5 points, then only you can come to a conclusion whether the patient is hot, chilly, or ambithermal. If he's ambithermal, then you can also, I'll just tell you regarding ambithermal. Now, grading of the thermal states. So there are 5 grades according to the summation of all the 5 points, which I just told you. So example, if 3 points are for chilly, you can write C3, C stands for chilly, A stands for hot. So the patient out here is both hot and chilly, but predominantly the marks for chilly are 3. So therefore he becomes a chilly patient. And vice versa here. Here the hot marks are 3, so he's predominantly a hot patient. Or you can say he's an ambithermal patient, but query hot patient, ambithermal patient, query chilly patient. That means what? He's ambithermal, but he could be a hot patient, or he's ambithermal, but he could be a chilly patient. Here we are not very sure, so hence the question mark should be mentioned out here. Thus, we can judge the thermal state, which may be useful to us while selecting the indicated remedy. So, if we can judge the thermal state correctly, and also if we can if we can match it with the remedy, then we can select the right medicine. If the thermal state of the drug matches the thermal state of the patient, then it will only boost our confidence while prescribing. So, if the thermal state matches with that of the drug, then you will be more confident in prescribing. On the other hand, it is important to remember that you don't have to be rigid in matching the indicated drug with the thermal state. Now, this is very important, that you don't have to be rigid, that if the indicated remedy is hot and if the indicated totality is a chilly totality, then also you can prescribe it. So please remember, you do not have to be very rigid. Let us see something more in detail about it. If after taking the totality of symptoms, you come to the synonym, say a drug X, and the drug has a thermal state of being chilly. Now you've taken the case and formed the totality, but the patient has a hot thermal state. So the question will arise, will you prescribe the drug or will you change your prescription? Well, it is worth remembering that if the majority of the symptoms match the totality and the thermal state does not, then prescribe the remedy or prescribe the drug. So it is worth remembering that if the majority of the symptoms are matching the totality and only one point of thermal state doesn't match the totality, it doesn't matter. 90% of the drug is matching except one thermal state, that doesn't matter. You can definitely prescribe the drug. That is why I said, do not be too rigid in selecting the medicine. Yeah, do not be too rigid in matching the indicated drug with the thermal state. So this is point worth remembering. Please kindly remember this. The matching of the thermal state of the patient to the drug is not so important if all other symptoms are similar to it. As I just told you, or just as a reminder again, that if majority of the symptoms are matching and the thermal state only is not matching, then it doesn't matter. You can prescribe it. A useful table given by Dr. Gibson Miller of hot and chilly drugs may be useful. So you can just have a look on the hot and cold remedies by Robert Gibson Miller. It is given in Borix Materia Medica. You can refer that. Remedies predominantly aggravated by cold. So in bold, you're getting the 3 marks. In italics, you're getting the 2 marks, and ordinary writing, you're getting 1 mark. Similarly, remedies predominantly aggravated by heat, and remedies both sensitive to extremes of temperature. So you can just refer Borix Materia Medica, and it is given out there. Also, you must bear in mind that certain drugs which are predominantly hot in the acute states are chilly and vice versa. So this is also quite important to remember. Say, for example, sulfur, you all know it is a hot patient, but in the acute state, it is chilly. Thus, once again, remember that if majority of the characteristic symptoms are matching the disease condition and the thermal state is not, then go ahead and prescribe the drug. It will definitely act in the right direction. Well, now the problem comes when you come across a patient in the age group of a few months after birth, or say a child in the age group of 1 to 3 years. So you are getting a patient, a neonate, or a child in the age group of 1 to 3 years. So how will you define the thermal state? Well, this is a very tricky question. So in this case, you have to rely on the parents for the information. Ask the parent, especially the mother, the patient's reaction to heat or cold. So definitely you have to ask the mother, because the mother is more well-versed with the child rather than the father. So the mother will be in a better position to tell you the reaction of the patient. So if an infant is there, again, it becomes very difficult to judge the thermal state. But you can ask these questions and you will be in a position then to decipher whether the neonate is hot or cold, or hot patient or a chilly patient. Now, what questions do we generally ask? Does the patient like to be covered or wear a cap with ears covered? So if a neonate is there, you have to ask the mother that do you wrap up the child tightly, or do you also cover up the ears? Or in winter season, does the patient like to wear warm clothing or a sweater? That also you have to ask. Or also your power of observation will be of great use to identify the thermal state. So if the patient is in front of you, then you have to observe the patient and see whether the patient is irritable, cranky, or tries to pull out the covering in which the patient is wrapped. So if a neonate is there, if the neonate is tied up in a cloth or a towel, and observe the neonate's reaction. So if some people, if they are hot, they will try to wriggle out their fingers or their toes, or they will be uncomfortable, they will be crying. The moment you uncover them, they are comfortable. So see the patient tries to wriggle out the limbs from the covering. See the patient's calm, placid, or peaceful when covered. See if the patient tries to pull out the sweater when covered with, or if a child is there 1 to 3 years of age, if the mother forces the sweater on the child will try to pull it out. If in sleep, ask if the covering stays on or the patient removes it. This is also very important. While sleeping, generally the parents cover up the children with a blanket or with a chadar, and later on the patient then removes it in his sleep. So that will also give you an indication that the patient is a hot patient. Also, if the fan is switched off when the patient is sleeping, does he get up or feel uncomfortable? So some people will say that, doctor, my child always wants the fan. Moment I switch off the fan or the AC, my child will get up. All these small observations, either by the mother or the physician, can be useful in classifying the patient as hot, chilly, or empathy. So these are the questions which you will ask in a neonate or in a young age group of 1 to 5 years, which will help us to decipher whether the patient is hot, chilly, or empathy. To conclude, it does definitely become difficult to identify the thermal state of a neonate, but not impossible. The older the patient is, it becomes easy for us to decipher whether the patient is hot, chilly, or empathy. Always remember to take the patient's reaction as a whole to the environmental influences. This is a very important point. Always take the patient's reaction as a whole to the environmental influences. Do not take the reaction of a particular part, organ, or location of the body with reference to thermal state. This is again a mistake which most of the students do during the examination. They say that a particular part is better by hot, is better by cold water, so the patient is a hot patient. No, that will be wrong. You have to take the patient's reaction to the whole and not of any particular part, location, organ of the body. So please keep that in mind. So that's all. It's a short video. I hope this video makes it clear for all of us to fathom the thermal state of the patient with ease. Also, please do comment, share, and like. Thank you very much. I hope you enjoyed this video.